Vaccine experts for the FDA are meeting actually right now to discuss the future of COVID-19 shots in the United States. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. We'd love to see you, Doctor.
Great to see you, Dr. Moffatt. Thankfully, you're at home and not in a car stuck in the expressway.
Right.
So, as you know, parents have been reluctant to schedule COVID doses for their kids, especially the younger ones. In fact, right now, as we just mentioned, only 14% of kids under 5 in Massachusetts are fully vaccinated. So do you think that some parents may be confused about the number of shots to get and when?
I think it's definitely possible that parents are confused because, frankly, it has been confusing because the authorization of the various bivalent vaccines and primary series really happened in a rolling fashion based on age. But maybe one simplified way to think about it now is that in terms of what it means now to be as up-to-date as possible on COVID-19 vaccination is first to have completed a primary series. And for kids, that really means either with Pfizer or Moderna. And second, for almost everyone between 6 months and 17 years of age, to have received one bivalent booster dose at least 2 months after completing their primary series. The only group for which there's a different recommendation are the 6-month to 4-year-olds who are finishing that primary series with the Pfizer. For that group, they're actually finishing that series now with the bivalent version of the vaccine.
Doctor,
so those are the simplified
I'm sorry.
Yeah, no.
I'm sorry to interrupt you. So the FDA says that it wants to simplify this process. What does that mean?
Yeah, I think what they're going to largely be discussing is really trying to make it less confusing and with the hope that it will enhance uptake of these vaccines, as long as that still aligns with what's best for immunity and vaccine coverage based on the circulating strain. So they're going to be talking about maybe moving towards an annual COVID-19 vaccination campaign using a vaccine that's based on the predominant circulating strain, much like what's done for influenza. So I think that will really be the crux of their discussion today.
So, but Dr. Moffatt, you know, kids already get a lot of vaccinations in the doctor's office. And I'll be honest with you, I remember as a youngin', I didn't want to get shots. So would you have any concerns about adding yet another one?
From an immunity standpoint, I wouldn't really have any concerns. We have decades now of history successfully immunizing children against multiple pathogens at the same time. And that's either by combining several vaccines in a single shot, and it's also at the same time by giving several shots at the same time. And if there were, for example, a vaccine that combined COVID-19 and influenza immunity in the same shot, that could really be a pivotal improvement to an annual campaign, for example, to simplify what it means to stay up to date on these annual seasonal vaccinations, as long as such a combination vaccine was found to be safe and effective.
All right. Dr. Kristen Moffatt, thank you so much for joining us.
Great to see you, Dr.
Stay well.
Moffatt. Take care.
You too.